Cranial cruciate ligament rupture, or CCL sprain, is one of the most common reasons for dogs to limp or be lame in their back legs. And unfortunately, when the CCL ruptures or is injured, it is going to lead to arthritis. So I want to cover all of the aspects of CCL sprain, and first we need to start with the anatomy and understanding why dogs tear their cruciate ligament or have a sprain in the first place. So just starting with the anatomy, I would like to compare a dog knee to a human knee. And so there are a couple fundamental differences between dog knees and human knees. The first one is literally just what we call it. So we call the dog knee a stifle and a human knee a knee. But essentially they're the same structure. They're where the femur bone or thigh bone meets the tibia or the shin bone. Now we know that dogs, when they stand on four legs, but when you look at your dog, their knee joint or their stifle is angulated right here where that bend is. And on average, that angulation is about 135 degrees, but that's very variable depending on what breed of dog you have. Humans, we stand straight up. So we basically have no angulation of our knee. So that's one important point. The next important point is when we look at the tibia, so the tibia is the shin bone, the top part of the tibia is called the tibial plateau. And dogs have a downhill slope to the top of their tibial plateau. On average, that downhill slope is about 25 degrees. Again, that's going to vary depending on the dog and somewhat on the breed, but in general, 25 degrees is the average, whereas we have a flat surface that we stand on. Now, this is going to come back into play when we talk about the types of surgeries that we can do to treat a CCL sprain. But so that's the basic relationship of what makes up the knee or the stifle joint. So other big things to point out, what is the CCL and where is it? So the CCL stands for the cranial cruciate ligament. That's analogous to the anterior cruciate ligament in humans. And just to back up a little bit further, a ligament is something that connects two bones together. So cranial and anterior are just the anatomists decided to call it cranial in dogs and anterior in humans. So the cranial cruciate ligament is this thick green line. It's a ligament now connecting the femur to the tibia, and we have essentially the exact same relationship here in the ACL and the humans. So this ligament, the CCL or ACL, is like a braided rope, I think of. It's millions of little fibers working together to provide some strength and stability. And the job of the CCL is threefold. Number one is it prevents hyperextension of the knee, meaning this joint opening up too much, or if you picture a football player kind of getting chopped in the knees, that overextension, that's one of the primary functions that the CCL or ACL prevents. The second is preventing internal rotation of the tibia relative to the femur. So that's sort of a twisting motion, prevents over-rotation of the tibia. And the third motion it prevents is what we call cranial tibial subluxation, cranial tibial thrust, cranial drawer, all different ways to say the bones moving back and forth on one another this way. And again, when it comes to treatment, particularly surgery, this is the motion that we're most concerned about, that anterior or cranial drawer motion. The last structure that I want to point out is the meniscus, and that's this blue area here. The meniscus is a little cartilage pad that sits on top of the tibia in both the dog and the human. And in fact, there's actually two of them. There's the medial and the lateral, and that just relates to whether it's on the inside or the outside of the joint. And the job of the meniscus is, we like to say it's a little shock absorber, but that's not actually exactly what it's doing. It is working to help provide congruity or help the two joints shape kind of work together a little bit better. But that meniscus is a very important part of the overall joint structure. Now, just for completeness sake, this green area here is called the medial collateral ligament. That's a ligament on the outside of the knee that helps prevent opening up of the knee in the opposite direction. There's a lateral collateral ligament on the other side. And then there's a caudal cruciate ligament, and in humans it would be a posterior cruciate ligament that crosses. And so the word cruciate essentially means X. So we have cranial cruciate ligament, caudal cruciate ligament. So that's our anatomy. Now the big question, and literally the question that's on every veterinarian's, every veterinary surgeon's, and certainly every dog owner who's had to go through this, is why does the cruciate ligament rupture in the first place? It's still a big question mark. We don't know the exact answer. There are a lot of different theories. There's a lot of research going on, but the things that we know in dogs is it's rarely one single traumatic incident, where in humans, ACL ruptures are very commonly related to sports or a traumatic event where all of a sudden that ligament tears and pops. In dogs, it's almost always the opposite. We think that cruciate ligament disease is actually more analogous to something like hip dysplasia, something that dog is already inherently born with. We know that there are certain breeds that actually have a genetic predisposition. So Newfoundlands, the genetics have been worked out that Newfoundlands can have a genetic predisposition to having that cruciate ligament rupture. There are certainly other breeds that are overrepresented, and there are definitely things that can increase the likelihood of a cruciate rupture, most specifically being dogs being overweight and if they have a medial patella luxation. I'm not going to get into medial patella luxation here, but there's more information on the website that you can learn about MPLs or medial patella luxation. But just to say that it's really, really uncommon for that cruciate ligament to just all of a sudden tear one time. More commonly, what you'll notice and what's happening is that ligament is predisposed to being weak. It's already a little bit injured or damaged. There's probably already some inflammation going on inside the joint. And then what that means is that ligament can get stretched a little bit. And now when we talk about a sprain, so we'll talk about either a CCL sprain or a CCL rupture. A sprain is now where that ligament has been stretched. So you think about if you've sprained your ankle, you twisted your ankle, the ligaments in your ankle have been stretched. We can grade ligament sprains into 3 different categories. A grade 1 is where the fibers of the ligament are stretched, but they don't rupture. There's no actual physical disruption of those fibers. That stretching can be painful, and that pain is essentially the body's reaction to something being abnormal, and it's saying, protect yourself, don't keep doing the thing that made it stretch in the first place. So grade 1 sprain means that it's uncomfortable, it's not normal, but there's no instability in the joint. A grade 2 sprain is now where we have stretching, but we have a few fibers that have been disrupted. And with that, we do have some instability, and we still do have some pain. And then a grade 3 sprain is essentially a complete rupture. So those fibers pull apart, and now we have a complete separation of that ligament, and the ligament essentially is not doing its job anymore. The most common scenario that we see in dogs is that they will develop a partial cruciate rupture or a sprain of their CCL, and that will wax and wane over time. Essentially what that means is you'll see your dog favoring or limping on that leg a little bit, particularly after heavy activity. When they rest, they seem to get better, and then they go back to activity, and then they limp a little bit more again. And it's this sort of cycle where that ligament isn't getting back to normal, and it's uncomfortable. And then very commonly, there's that one last squirrel, or there's that one last ball throw at the park where the ligament can then completely rupture, and now you're seeing a more obvious limp or lameness. So when the cruciate ligament is torn, so let's say that it is completely ruptured here and we've lost all of the function of that ligament. What is essentially happening is now when the dog is bearing weight down through their leg, this downhill slope here to the top of the tibia, the femur tends to roll off the back of the heel. We can think of it as kind of downhill slope here, femur comes down and rolls off the back of the heel. Now, of course, what I've not shown here are the hamstring muscles and the other muscle groups that can provide some degree of support against that abnormal motion. But that's essentially what's going on if your dog's bearing weight and it has a sliding sensation. The femur is rolling off the back of the heel. When the ligament is injured or sprained, even in the early part of the condition, the first thing that we're going to notice on our physical exam or on x-rays is going to be swelling inside the joint. So there will be what we call joint effusion. So when we have joint effusion, it means that there's essentially swelling inside of the joint, and this is inflammation. This is the body's reaction to that ligament not being normal. I say it's the body's reaction, but there's actually a school of research and thought process that this inflammation may actually be there before the ligament is injured and predisposes it to being injured. Not going to get much further into that other than saying the very first sign that your veterinarian is going to find is they can feel this effusion in the knee and they can look for it on x-rays. Now, we definitely recommend doing x-rays if we suspect that there's a CCL injury. we are not going to see the CCL or the ligament on the x-rays. We can see the bone and we can see the swelling inside the joint, but we cannot see the ligament itself. We're just looking for secondary signs. We don't typically do an MRI in dogs. So if it were you or I and we had an ACL sprain, our doctors would probably recommend that we have an MRI as a diagnostic. We don't generally do that in dogs for a few reasons. Number one, the expense that goes along with that. Number two, dogs have to be completely anesthetized to get the MRI. And number three, we're just pretty good at diagnosing it without needing the MRI. That being said, there's rare cases where I have needed to take a dog for an MRI to diagnose a very, very early ACL or CCL sprain. To summarize how we would diagnose a CCL sprain, the first thing is going to be your veterinarian palpating the dog's knee and looking for a few different signs that may suggest there's discomfort in the knee and swelling in the knee. The next thing they'll probably recommend are x-rays to look for swelling in the knee and any secondary changes that go along with the arthritic process. Now, one of the things that can happen in addition to a CCL sprain or CCL rupture is an injury of the meniscus. And now I've drawn the top of the tibia here as if we're looking down on the top of it. And this is the medial meniscus, or the one on the inside of the joint. This is the lateral meniscus. And there's a little bit of a difference here. This lateral meniscus has a tail that attaches to the femur. And because of that, anatomically, it's not as prone to getting injured as the medial meniscus is. And the reason being is if we have an ACL rupture, weight is being put through this femur here and it can roll off the back of the heel, and then it can start to crush or damage the medial meniscus right here. The lateral meniscus is actually moving out of the way along with the femur. But we can get an injury right here in the back of the meniscus, and that is actually what we consider to be the most painful part of the whole cruciate ligament disease process, or cruciate ligament rupture. That basically covers the overview of what a CCL sprain is. Look for our other videos on different treatment mechanisms for CCL ruptures and CCL sprains. And be sure to check out the accompanying article that goes into more detail of everything I've just covered right here.